company Eli Lilly made a giant step this week to help diabetes patients afford their monthly insulin, capping that medication cost at $35 per month. Now, to see how this will impact Central Texans, we have Dr. Kajal Shah, and she is with Texas Diabetes, and she is joining us today. Thank you so much for being with us.
Oh, thank you. Thank you for having me.
So let's start with this. We know that high medication costs have really been a major barrier for people with diabetes and even people who have been undiagnosed. But how will this help improve access?
Right. So, diabetes, just a little bit of background, it's a disease that is characterized by high blood sugars. So people with diabetes either cannot make enough insulin or they can't use it appropriately. So insulin as a medication was discovered about 100 years ago. And even though it is accessible, I think affordability has always been an issue, especially in the United States. The average cost of a vial for somebody who does not have insurance is about $200 to $300 a vial. And that, is very expensive, and that leads to a huge financial burden. And because of that, we've had patients, sometimes skip their insulin or not take it at all. So this announcement by Eli Lilly of capping the insulin cost at $35 a month is a huge announcement, and we were obviously very thrilled by it.
Certainly is a huge announcement. When will all of this take effect?
Yeah, so based on the announcement, it looks like the Lilly Insulin, those who have commercial insurance plans and currently are on their branded insulin, it takes into effect immediately of capping the cost at $35 a month. And, starting, I think, May of this year, they have reduced the cost of their non-branded insulin vial to $25 a vial, which is a huge reduction. And they're also planning to reduce the cost of their branded insulins like Humalog and Humulin by 70%. I think that's happening in the last quarter of this year. So we're all very excited by that.
Okay, so we've seen what Eli Lilly has done. Do we think that other companies will follow suit?
Yeah, I mean, I think that's the hope. I think, given the Insulin Affordability Act that was introduced beginning of this year by the central government, and, patients with Medicare Part D have benefited quite a bit from it. And this followed by Eli Lilly making this announcement. We only hope that other pharmaceutical companies and manufacturers follow suit and, make insulin more affordable for our patients.
Okay, doctor, thank you so much.
Thank you. Thank you.